Virtual briefing to update our community on changes to Horry County Government operations in response to the impacts of the novel coronavirus, COVID-19, within our community. We continue to follow the guidance provided to us by our state and federal partners. We have activated the Horry County Emergency Phone Bank for questions regarding county-specific functions. That number is 843-915-5000. We will have a series of speakers this afternoon to provide updates, and we will take questions from the media at the end of this briefing. Media members are reminded to text your questions to Michaela Moskov in the Public Information Office. At this point, I will turn it over to Horry County Council Chairman Johnny Gardner.
Thank you, Kelly. Thank you, Kelly. I appreciate that. I'll be very brief, and then I'll turn it over to our county experts. What's important to know that this is a rapidly evolving situation. It's fluid. We're taking all the steps necessary in conjunction working with our state, local, and federal partners and figuring out what's the best thing to do for our citizens and residents of Horry County moving forward. The key is flexibility and teamwork, cooperation. We are having this meeting today not to cause any panic or to get people worried. It's to let you know where we are and what we've got going on. So with that in mind, I would like to bring on Randy Webster to do some heavy lifting on the details.
Thank you, Mr. Chairman. I am Randy Webster, Public Safety Director here in Horry County, and working with the Public Safety Group and the entire departments of the county and administrator. We all just want to say thank you for everybody's patience as we move forward into this most unprecedented event that I'm not sure we've ever seen. And unfortunately, we don't know where it's going. We don't have a forecast, so to speak. We don't have an idea of how bad the impacts could ultimately be. We don't have an end time to work with, like we would in hurricanes or other natural disasters. So we're all trying to work through this, and we're trying to work through this with as much information that we can get. We're following the lead of DHEC and the state in terms of how we're going to handle this public health emergency. I'm very proud to say all of our county staff, county departments are coming together exceptionally well. Flexibility has been the key, and we're all just as concerned as everybody is in the public how this might impact us, our families, and us individually. So once again, thank you for your cooperation, and thank you for your patience as we continue to move through this event. We will get through it. We will, just like other events we've had in Horry County, we will get through it. One of the biggest differences is the impact area. It's not just the coastal counties or Horry County. It's not just South Carolina. It's state, nationally. So we're all facing significant challenges on resource requests and resupply of significant medical equipment or supplies to assist the medical community. But right now we're good in our operations within the county. Our staff at public safety will be responding. Law enforcement is responding to calls and will be. Fire rescue EMS is responding to calls and will be. And 911 is there to receive your calls and will be. And the rest of county government is here functioning, and we will be. We will see some significant changes and some significant inconveniences over the time to come. Right now, we have sent the information out that our county offices will be closed to the public, but we will allow limited access to those that need to have access by calling ahead for the department that you need to talk to. We know transactions need to take place, and we're here to assist you in making sure we can get those done in a safe manner, and a safe manner for yourselves, your family, our employees, and our community. So we just continue to once again say thank you for your patience and cooperations with this. We are watching this 24 hours a day. We're monitoring it not only in Horry County but surrounding areas. We're talking every day with our local communities, coordination with the state agencies, everybody that we would normally work with in a natural disaster event, we're still working with. But we are taking the lead on this as a public health emergency from DHEC, and we're following their guidance. And unfortunately, fortunately, as they learn more about this virus, the guidance does sometimes seem to change a little bit, and we're all having to be flexible with that. So as we continue to move ahead, we just ask that if you have questions, we're providing numbers for you. If you can do business with the county online, that's great. We prefer that. But we are here to serve, and we will serve as much as we can. And our goal is to maintain critical services, critical facility operations through this event. And I just wish I could tell you how long it was going to be. But we're in this for the long haul, and we'll be making adjustments each and every day. As we learn more and as we can make adjustments to make it easier for everybody, we certainly will. So with that, I'd like to turn it over to our sheriff and get an update from him.
Thank you, Randy, and good afternoon, everyone. We are, like Randy had just mentioned, we're going down a road that we haven't been before in this capacity. We've had disasters and events that have occurred, and we've always done what I feel to be a very good job. And we got the same team doing this that we've done our previous disasters together. What a great team we have. We're working together very closely now. We're sharing information as it comes in, and I feel very, very confident we'll get to where we need to be. I think the main thing I want to get across to everyone, and is what I've told our staff when we had our staff meetings yesterday morning to start doing this. If we can just stay calm, if we can just remain calm, take it easy, and use our good common sense and our judgment and listen to the advice that's being given to us on what to do. I know that we will be changing from day to day. The possibility is we'll have to change. And there's everyone that we've been in contact with on the state level, the national level, and here. Everyone's got the same common goal in mind, is what's best for our citizens and how to stay safe. We will get this information out to you as quickly as we get it. And we care very, very much about the safety of our citizens, our community, and what we have to keep in mind is our employees that's out there on the front line administering these services to you. So we're dedicated, we're ready to go. The sheriff's office, we are business basically as usual, except we are providing a little more security in and around the Justice Center here. Mr. Webster mentioned a few minutes ago about the offices being closed. We'll be here. In the event you have an issue or a problem, we'll get you where you need to be. Our detention center is closed down to the public, but we are screening everyone that comes in. We're there with our medical staff to assist with our employees, with the folks that's there. Some people may have a question about having a family member or relative or someone in custody, and they want to see them. Our visitation has stopped as far as people going to the detention facility. You can go online and get our Securus website on that, and you can do video visitation from your residence or wherever you need to be. That's something you need to think about. So basically, we're working, got all hands on deck. We're making sure our employees are safe, and we're practicing personal hygiene constantly, and just do not hesitate if you've got an issue, if you've got a problem, to pick that phone up and call us. I would also like to encourage you to check with your neighbors, the folks in your community, maybe the elderly, in and around where you are, relatives. Make that phone call. Check them. See if they need something or how they're doing. That can bring some reassurance to them out there, and also make you feel a little bit better doing it. So let's just continue to press on. Main thing I got to say is stay calm. God bless each and every one of you. Chief Hill.
Thank you, Sheriff. Good afternoon. My name is Joe Hill. I'm the Chief of Police for Horry County Police Department. And what I want to convey to you is that the Horry County Police Department remains flexible and adaptable to the changing needs of our community and the situation at hand. Patrols and investigation will go on as normal. You may see some slight changes, and that would include officers may ask you to come outside if you are wanting to speak to an officer as you call in, or an officer or supervisor may call you back and ask you to take that information or take that information from you via the telephone. We're also encouraging our public to use the online reporting system, which is CopLogic. You can find that information on our county website, police department website, and it's very easy and user-friendly. As the sheriff said, I am very thankful to a great community who works with their neighbors to make sure that they're taken care of. As the sheriff said, make a phone call to your neighbor. If you need to get groceries or medication, you're going to have to work that out. But for groceries, you can go get them, place them on the doorstep, walk away, and you know that your neighborhood's being taken care of. Your Horry County Police Department is here to help you. Although the facilities starting tomorrow will be closed, you can still get help by calling the non-emergency number or the precinct number, which is provided to you on our Facebook page. With that said, I'm going to turn it over to our Fire Chief, Chief Joey Tanner.
Thank you, Chief Hill. I want to iterate, as Chief Hill and the Sheriff has also said, Horry County Fire Rescue operates as normal. Our day-to-day operations continue. We haven't seen a significant increase in call volume, but we're continuing to respond to your calls 24 hours a day. We're in constant conversation with our partners in the cities and the counties and the region areas to see how things are going and see what resources we have together we can share if we need them. But I can also assure you that we have adequate supplies and personnel staffing to move forward here. We check our resources every day to make sure we have those in place there, and then try to identify those that we need to try to find from somewhere else. Our number one job is making sure that our citizens remain safe and healthy. So at times when we do respond to your calls, you may notice they're dressed a little differently, and that is the proper protective clothing they may need to respond to these incidents. And it's twofold. It's not to say that we believe everybody has this particular virus, but it's also to protect them and also to protect our employees, to make sure everybody is safe. We'll be in constant contact with our hospitals as we continue to respond to them as well, to make sure everybody is taken care of. The top calls that we're talking about going to now, the reason where there's PPE, is because it's an infectious disease that we're accustomed to. We have an infectious disease protocol that we've used for years. Nothing has changed. We follow the CDC and the DHEC guidelines moving forward, and we check with them on a daily basis to see what changes needs to be made, if any. We're also in contact with our crews in the street. Every morning we have a conference call with all of our stations, with command staff, and every afternoon we send them some updates of what's changed, if anything's changed throughout that day, and any operational issues that we see. But as the sheriff said, I think is great, everybody remain calm. We take care of each other, look out for each other, and I think we'll get through this with no issues whatsoever. So thank you very much. At this time, I'll turn it back over to Randy Webster.
Okay, I want to take an opportunity to address a few questions that we have been receiving over the course of the last few days. So one of the questions has been, how, as an individual, can I get tested if I feel I have the COVID-19 virus? And the answer to that is we're following the DHEC guidelines and the direction from DHEC. And the best answer I can give you for that is to go on DHEC's website, scdhec.org, and it will give you instructions and information on how to follow up with that question. You can also contact your local medical healthcare facilities to ask the question, and they should be able to give you that information as well. We've also had questions regarding how come are we going to regulate or in any way compel businesses to adhere to the CDC guidelines and recommendations for gathering of crowds? The answer is we are going to take the guidance from the state on that issue. We are, all the businesses have to make their decisions based on their own situation. We want to encourage everyone to continue to practice social separation as much as possible, but we will not be going out as Horry County Government and making those types of enforcements. So at that point, I'd like to open up for additional questions, if we have any.
We don't have any. at this
We
time.
don't have any? Okay, well, thank you very much. That concludes, oh, one other thing I do want to say, I'm sorry. When I mentioned about the offices of the county are closed, that does not include the airports. The airports are open. If you have questions regarding the airport or your airlines, please contact them directly or the airport directly and to receive that information. So with that, I think that concludes our press conference. We thank you very much. And once again, we're in it together. We'll get through it. And we appreciate your support and supporting our county operations and our staff. And we're all here as a group for everybody. So thank you very much.